Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Saturday, June 20, 2026, episode 64. Today, Frontier AI Health Intelligence just became free for 230 million users worldwide. Belize releases the national data to make the budget case for early warning investment. And Anthropic's Claude Core opens a paid pathway into non-profit AI work with a July 17 deadline. We start with OpenAI, which rolled GPT-5.5 Instant out to all free ChatGPT users worldwide on June 19. Over the prior 2 months, the upgrade produced a 71% decline in health response factuality errors, with specific improvements in recognizing when urgent care is needed, asking for clarifying context before answering, and making medically complex topics accessible to general users.
What makes this significant is the distribution question. That 71% improvement now reaches free users, including a large share in low- and middle-income countries, where ChatGPT may be the most consistent health information source available. Frontier-level clinical reasoning, previously gated by subscription, is now in a free account in every country ChatGPT operates.
OpenAI reports the model is explicitly optimized to surface uncertainty and direct users toward professional care when symptoms suggest it. 230 million weekly users. That is a health information reach few NGOs can match at that cost.
The 71% reduction is directional, not a guarantee. Organizations deploying health information for communities should know what their communities are already receiving when they query ChatGPT on symptoms, medicines, or care seeking, and they should test in the languages their communities actually use.
The numbers are specific and the access point is real. But a factuality improvement does not replace clinical verification for anything consequential.
For practitioners, the action is audit before endorsement. Run your most common queries, symptom triage, medicine dosage, referral language, in the languages your communities use. That is the governance test before you recommend it at field scale.
Moving to early warning finance. In Belize, 2 studies released June 19 by the WMO, the World Meteorological Organization, and under the UN Office for Disaster Risk Reduction just gave national governments the ROI numbers they have been asking for.
What makes this significant is the source and the methodology. Every Belize dollar invested in the National Meteorological Service of Belize returns between 3.30 and 6.80 Belize dollars in economic and social benefit. Every dollar invested in the National Emergency Management Organization returns 6.42 Belize dollars in avoided losses. Nationally grounded, primary data, WMO-backed.
Undercommissioned both analyzes under the CRUISE initiative, the Climate Risk and Early Warning Systems Multilateral Fund, implemented jointly by WMO and UNDER. The methodology captures direct losses, property and agriculture, and indirect losses, health and livelihoods. Belize is a small coastal state. The study design was explicitly built to transfer to similar settings.
Advocacy teams in climate-vulnerable countries now have an independent ROI figure to carry into budget negotiations. Cite the primary national data, not the global 10-to-1 average. And the CRUISE initiative is the implementation funding pipeline. That is the mechanism for getting a country-specific analysis done.
Third signal, workforce. Anthropic is placing 1,000 full-time AI fellows at 60 nonprofit partner organizations over 3 cohorts, starting in October. Fellows earn $85,000 per year, full benefits, fully Anthropic funded. Host organizations receive a $10,000 implementation grant plus API credits. The program is called Claude Core.
The partner list is the operational signal. IRC, the International Rescue Committee, Code for America, RAIN, Goodwill, Year Up United. These are organizations doing refugee assistance, food security, survivor services, and civic tech. The field deployment infrastructure is already there.
The first cohort is 100 fellows. Applications close July 17, 2026, 27 days out. Placements begin October 2026. The program is administered with CodePath as employer of record and social finance on measurement and evaluation.
2 audiences need to move now. Nonprofits eligible to host should apply at the Anthropic Claude Core page, links in show notes. Individual candidates, 18 plus, under 2 years of work experience, U.S. work authorization required, no degree required. If you work with that population, direct them to apply today.
Story 4. The Philippines and Japan announced June 19 a 4-month technical collaboration to build an AI-ready national disaster risk data platform. The Philippine Department of Science and Technology and JICA, the Japan International Cooperation Agency, are integrating disaster risk, geospatial, climate, and hazard datasets from multiple government agencies into a single interoperable architecture. Data sovereignty is preserved. Each agency retains ownership of its datasets.
The architecture is the replicable part. The Philippines is among the most typhoon-exposed countries in the world, and building AI readiness from the data layer up while keeping agency data ownership intact is the template worth studying. DRR technologists working on national data infrastructure in Southeast Asia should track JICA DX lab materials as this technical phase runs through October 2026. That is the design principle worth copying.
On the disaster watch, Indonesia's National Disaster Management Authority, BNPB, and AHA Center, the ASEAN Coordinating Center for Humanitarian Assistance, are coordinating response after a magnitude 6.7 earthquake struck Palu, Central Sulawesi on June 16. 1 death, 74 injuries, 5,744 people affected, more than 1,360 homes damaged, 71 plus aftershocks. 3 regencies with a combined population of 1.2 million remain under assessment.
This region carries forward the risk from the 2018 Palu triple disaster: earthquake, tsunami, and liquefaction. Local soil conditions require careful engineering assessment before any damage estimates are treated as final. For teams evaluating satellite or sensor-based damage models, an active aftershock sequence in a known liquefaction zone is exactly the field condition where ground truth verification is not optional.
Funding watch, 2 deadlines closing inside 30 days. The OpenAI Foundation's 2026 People First AI Fund is open for US $501c3 public charities with annual budgets between $500,000 and $10 million, community support services, arts and culture, and community journalism, $50 million total. Deadline July 15 at 11:59 p.m. Pacific. And Claude Core host organization applications close July 17.
The OpenAI Foundation deadline is the one this audience usually overlooks. The budget threshold, $500,000 to $10 million, was designed to reach mid-size community organizations, not large institutions. The application prioritizes demonstrated community relationships over AI sophistication. That distinction is worth reading carefully before you draft the application.
The through line today: health AI access, early warning ROI, and nonprofit AI workforce all moved from aspiration to funded evidence this week. The field is not waiting for proof of value. It is waiting for practitioners to act within the window.
The deadline is the real filter here. Health query audits, early warning budget memos, Claude Core applications, OpenAI fund submissions, each has a clock. Organizations that move in the next 25 days will be deploying with this infrastructure by October.
That's Impact Signals for Saturday, June 20, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.